Doctors of Waikiki is now offering in-clinic and drive-through COVID-19 blood tests to first responders. And joining us live is Dr. Tony Trpkovski with Doctors of Waikiki to tell us all about it. Hey, Tony, can you hear me okay?
Yes, I can. Thank you.
All right. Thank you so much for joining us. Now, we're talking to you live because you actually have these blood tests still going on right now for first responders. Can you tell us a little bit more about what you have going on?
Well, we were limited up until this time by only doing PCR testing, meaning the nasopharyngeal swabs of people's noses that check for the virus actively in their nose. And now we finally came across another tool that will help us fight the coronavirus, which is antibody testing. We have antibody tests which are green-lit by the FDA to be used in the general public to test for coronavirus.
And so right now you've had first responders coming in. I know it started at 7, ends at 11 o'clock tonight. So have you guys seen a lot of first responders coming in?
Yes, we have. So our first phase is we are going to be checking all the first responders because they're in the trenches. They're the ones who are actually actively fighting this disease. And we don't want them to get sick, or if they're sick, we want them to be segregated. Our second phase would be checking those that have high comorbidities and those that are high risk. And the third phase will be doing the general public, if possible.
So there's a possibility.
Yes, we've had a good turnout. We've had about 30 plus people so far.
Oh, wow. That is a lot of first responders coming in tonight. Now, you guys also have drive-through clinics that you're going to be hosting. Tell us when those are and a little bit about that as well.
So starting tomorrow from 9 o'clock till, I think our last is 6 o'clock, we are having scheduled appointments that people have to go online. They have to go to our website, Doctors of Waikiki, and then schedule a set predetermined point in time to come in. Otherwise, it'd be just too crazy. And then people can come in, and there's no charge. We're charging the insurance, and it'll be really easy to do. They don't have to get out of their car. They'll come in through the back lot of the hotel, and then there's a parking lot. And they're going to go up into the parking structure and get tested while they're in their car. And we'll give them results within 5 minutes.
And if the first responders do want to sign up, how can they kind of go about doing that for these drive-through and for these in-house clinics?
You go to the website, Doctors of Waikiki, and there's a site there. You push a button on the site, and that'll get you to a form that you fill out, and you give all your information, and you get registered to come to the appointment.
And in your opinion, is there any difference between getting the swab tests and getting these tests done by taking your blood?
Yes, there is. So the swab test tests for the virus at that point in time. So let's say the day before you don't have the virus in your nose, but you think you're fine, and the next day you can have the virus in your nose, and you're actually positive you're a vector transmitting it. So maybe I checked you the day before, and you think, oh, I'm fine, but you're not. The antibody test actually checks your response to the virus over the past several weeks. So if you have the virus actively, it could show up as IgM. If you've had the test, or the virus in the past, it'll show up that you'll have either IgM and IgG, most likely just IgG antibodies that we've been finding so far in patients that we've tested via PCR in the past. And the PCR tests that were positive 3 weeks out are showing IgG antibodies, meaning that they probably have some type of immunity, which is great. We're hoping to monitor that and see how long that is going to be noted.
Well, Dr. Tony Trpkovski, we appreciate you taking the time. I know you've got about 45 minutes left of testing still, so we'll let you get back to work with Doctors of Waikiki. Thanks so much for taking the time. Have a great night.
Thank you. Thank you. Good night.